Here's a MRI of this patient. So you can see this is the diffusion weighted imaging, and X-ray imaging. You can see the big mass, which you can see it here involving the cera and then also supracellular component. This is very bright and homogeneous in T1 weighted imaging. And then this DWI imaging, you don't see any restriction. It's much less dense than brain tissue. So, but it's not totally fluid because CSF intensity in the DWI is like much darker. So it's much more thicker material than CSF, but it's much less dense than the brain tissue. And as you can see, the margin is very, very clean and then pretty much homogeneous, and there is no fluid level, or there is no nodular soft tissue component within the mass. And then you can see the floor of the cell almost right here is some soft tissue intensity here, and this may be the normal pituitary. And then if this is a normal pituitary, then the mass is above the pituitary gland. So usually the mass arising from the pituitary gland pushes the normal pituitary in peripheral portion superior to anterior portion. And if this is arising above the pituitary stalk or superior to the pituitary gland, the mass pushes down the normal pituitary. So that's one thing you can use this as a diagnostic clue. And the mass is sort of multilobulated, and then try to find a way to extend. So the part of the mass goes to the prepontine cistern on the right posterior portion here, and then you can see in T2 and FLAIR imaging, the internal content is very clean. If this is a hemorrhagic pituitary macroadenoma, usually you should see some fluid level or some hemorrhagic content. So it's very clean lesion. This is a pre-contrast on the left side, and this is a post-contrast. Because this is spontaneously homogeneous and hyper-intense, post-contrast study doesn't really show much difference, except most inferior portion of this tissue here, which I thought this may be the normal pituitary tissue, enhances like pituitary gland. I can't really tell where exactly the stalk is. If this is a normal pituitary, maybe stalk is kind of displaced in one way to the other and then stretched tremendously. You can see the stretched optic chiasm here, and then this is the right side, and left side is much more superior extension. So that's why maybe left side is more affected. This is again showing the chrono T2 and sagittal. And this is a very homogeneous, very bright T1, both T1 and T2 signal intensity. So the differential diagnosis is either craniopharyngioma or Ratkes cleft cyst. Usually the Ratkes cleft cyst is much smaller than this size. He's 38-year-old. The cystic type of craniopharyngioma usually happens in older population. We don't have a CT, so we don't know if there is a calcification. But if there is a calcification associated with this type of thing, you may see some dark spot in T2 weighted imaging, which we don't see. So there's something very smooth structural thing.